Good afternoon, everyone. I'm so grateful you're all here with us today. Some of you might be new to Compassion Institute and some may be returning. So welcome to you all. My name is Apratim Chowdhury. I'm the Program Director of Health here at CI. And whether you're joining us from a clinic, a public health department, community health, hospital, private practice, wherever you may be, we see you and we thank you for the care that you bring to the world. At Compassion Institute, our mission is to advance compassion as a guiding principle, not just in our personal lives, but in the systems, the institutions, and communities that we work in and live in. We believe that compassion is not just a virtue, but it's an active force for connection, care, and transformation. And our roots, our history goes back to Stanford University, where our co-founder, Dr. Thupten Jinpa, the principal translator for His Holiness, the Dalai Lama, helped to create compassion cultivation training. Since then, we've brought this work to leaders, educators, healthcare workers like yourselves, and law enforcement professionals all around the world. And what we all know and feel, and probably why we're here, is that healthcare professionals are facing more than just burnout. Many are holding moral injury and secondary trauma and exhaustion. That's not just about long hours, but it's about not having tools or space to care for themselves while they're caring for others. And what we believe and know is that compassion must be a part of that solution, not just for patients, but for everybody involved, the clinicians, the nurses, the staff, the leaders. And this is why Dr. Mansouri, who I'll introduce shortly, developed a unique research-informed training just for this context. It's called Compassion Cultivation in Healthcare. So it's my deep honor to introduce you to Dr. Shireen Mansouri. She is our health content lead, but also a brilliant clinician and physician, a teacher, and someone who brings immense depth and clarity to this work. She's here to walk us through the science, the structure, and the spirit of CCHC. Shireen, we're so grateful for your presence today. You can take it away.
Thank you, Apro. So welcome everybody. Thank you for being here. So what I would propose for today for my agenda, and we can go to the next slide, is I'm actually going to start with a short grounding practice to give us all a taste of how often our classes will start. A short introduction to Compassion Institute, but thank you, Apro, for already doing that. And then we're going to talk about compassion cultivation and then why and how we've modified things to create this new course, Compassion Cultivation in Healthcare. And then I thought I'd take you through a sample practice from the course so that we can get a taste of it. So moving to the next slide, I'd like to start with a grounding practice. And if you're in a place where it's available to you to either close your eyes or drop your gaze, please do so. Anything that allows you to turn inward. Obviously, if you're not in a situation where you can do that, that's fine. You can just listen. But for those of you that can, dropping that gaze, turning your attention inward, and let's take a moment to just arrive here. Arriving where you are physically, for us to arrive here as a community of interested people in compassion and healthcare. Taking a deep breath in, filling our lungs, letting it completely out. Taking another deep breath in, filling lungs and belly, and then letting it out, completely emptying your lungs and your belly. One last deep breath. And this one you can let out almost as a sigh. Now allowing your breath to just return to its own natural pace. Noticing that your body knows what to do. You don't have to think about it. And I'm going to invite you to draw your attention to your feet. Your feet are on the ground, being supported by the ground. My feet are actually on the same earth that your feet are on. All of us supported by this earth. And all of us here in this time and place because we've got an interest in compassion. This deep desire to bring more compassion to our world. We're all connected by that desire. Now again, returning back to the breath, noticing the inhale and the exhale. Taking a last couple of breaths. Slowly returning your awareness to your space and opening your eyes. So thank you for joining me in that. Now we'll go to the next slide. And as Apro said, our co-founder, Thupten Jinpa, he's got this quote: imagine if compassion was a celebrated value and an organizing principle for society as a driving force for change. So this isn't just about each individual person practicing quietly, invisibly on their own, but what if this was actually something that we're bringing into society and making more transparent and more visible? Going to the next slide, again, our mission is to bring compassion into society. And we do work with not only individuals, but with institutions and communities so that people can be having conversations together about all of these concepts. And we'll go to the next slide. So compassion cultivation itself is really the bedrock course that was developed at Stanford back in 2009 and transferred to CI, Compassion Institute, in 2017. And it has been taught all over the world by many teachers to many people. And itself, it's an 8-week journey. It starts, and we can just start clicking through the slide. So it starts with week 1, where we dive into what we call settling the mind. So some of the grounding practices we just did, and talking about the importance of cultivating awareness. Then we move into where is compassion easy to access? And it's easy to access with people that we know really well. Then we talk about self-compassion, not as easy. So that's why we spend 2 weeks on self-compassion. And we talk about not only self-compassion, but loving kindness for self and looking at our values and what's important to us. And then in week 5, we delve into common humanity in terms of how do we see other people that might be outside our normal circle of concern. And then as we move to week 6, we're sort of dropping this pebble in the water and watching it ripple out and looking at, like, how do we increase our compassion? Week 7, the second last week, we talk about a concept called active compassion. And then the very last week is called our integrated daily compassion, and how do we integrate this into our life? So this is this 8-week journey that we move through with a class. Each class is 2 hours long. And in between, there's meditations and practices, sort of homework that can be done. And it's an amazing experience for anybody who's been through it. you form this bond with this community that you're studying with, and you really get a chance in this sort of spacious environment of the 2-hour classes to explore these concepts. And our driving force beneath this, the real theory that grounds this course, is the fact that we believe that compassion is innate. Every single person has compassion. We also know that there are limits to compassion. For various reasons, society often throws these obstacles in our way, but the science has shown us that it can be cultivated. It can basically be strengthened just like a muscle. So much like going to the gym and building our muscle, we can practice compassion meditation, compassion cultivation, and build our compassion muscle. So there is evidence on CCT itself, and we'll go to the next slide. A number of studies have been done both in the general population as well as in healthcare. And specifically in healthcare workers, it's been shown that people who go through the CCT course find that they have increased self-compassion, increased mindfulness, increased job satisfaction, and decreased fears of compassion for others and decreased fears of exhibiting compassion for themselves. So decreasing in the barriers to receiving and giving compassion. And we'll go to the next slide. And there have also been studies done in medical trainees, medical students specifically, where they underwent a full 8-week CCT course and had increased observational skills, increased acceptance of emotions without judgment, which I think is a really interesting and important one. Increased use of the skills outside the course. So they started to use the skills that they were learning in the course just in their normal day-to-day activity. And there was some improvement in interpersonal interactions, self-compassion, again, mindfulness, increased ability to regulate emotions, not suppress them, but regulate them, and decreases in stress, anxiety, and emotional exhaustion. So we know that the evidence shows that the full CCT course has an effect on people, and this effect is somewhat durable as well. So why am I talking about a new course? And really, there's a few pieces to this. One, as Apro said, healthcare is just getting harder and harder and harder. We hit COVID, we put our heads down, we worked really, really hard thinking this is going to get better. And there have been all these lasting effects. COVID, I think, not only really showed the cracks in the system, it widened those cracks. We've had ongoing lasting effects in terms of human resource issues, financial issues, increased complexity of patients. The demands are getting worse or higher, and we have fewer and fewer resources to meet those demands. And it seems like every day you show up for work and there's some new obstacle in front of you to just doing your job. And all of this can create more obstacles to compassion. So it's become more important to bring compassion and the skills of compassion cultivation and this philosophy that we can strengthen it to as many healthcare providers as possible. And my dream has always been to be able to offer a specifically healthcare focused course. And the other thing is, as I've taught over the years, I know that 2 hours a week for 8 weeks is so hard for people to commit to. They just don't have the time. Juggling both personal lives, families, as well as busy jobs. And anybody who works shift work obviously can't attend at the same time every single week for 8 weeks. So we went through this process of adaptation where I looked at both the content and the structure. So we'll go to the next slide to show what I've done. And basically, we came up with this course. We're calling it Compassion Cultivation in Healthcare, acknowledging that compassion exists, but can we make it stronger? And we're shifting the idea of weeks to modules, so it can be still delivered in a weekly format, but it doesn't need to be. So the 8 modules, there are still 8 modules. They still talk about this building awareness as module 1. So we'll start clicking through that. And then we move on to focusing on empathy, which is a critical part of compassion, but not the whole story. We talk about self-compassion, which is incredibly important for healthcare professionals. In the second piece to self-compassion, we really drill down on values and purpose because we know that this sustains us in our work. And this is what we want to just keep coming back to and back to over and over again. We then move on to common humanity, just like in compassion cultivation. In the 6 weeks, we talk about widening that circle. So how do we expand to people who might be difficult for us? And we start to look at some of the actual obstacles and specific content around things like moral injury. Then we move into active compassion and finally look at that integrative piece. So how do we sustain that compassion? What's the thing that is going to help us not feel depleted and how can we continue these tools down the road? So I've changed the structure somewhat. The content is very specific to healthcare, using evidence-based in healthcare and using language that's important in healthcare. And like I said, bringing in specific concepts around moral injury. And we'll go to the next slide. So this can then be delivered in a number of different formats. So it can either be done weekly, virtually. The first class is still a 2-hour class because I found that time is really needed for creating this cohesion of this community that's going to learn together. And then it's 1 hour weekly. It can be as few as 6 weeks total. If you want to skip weeks 6 and 7, which are dealing with some of the widening the circle and the more difficult situations, or it can be a full 8 weeks. And then the other way it's designed is to be done in person, either as a 1 to 1.25 or half day program, so that you could be bringing a team together who's just taking that day to do the work. So this would be especially useful if it was attached to a conference or if you had shift workers or a team that you wanted to bring together for a retreat. So that's the format. Now, what I would like to do is I would like to lead you through a sample practice. So we'll go to the next slide. And this is a practice called the Just Like Me practice, and it's a practice of common humanity. And it's recognizing that even though every single person is unique, the thing that joins us all is that we are all vulnerable to suffering. We will all face suffering. That can look different for each of us, but we will face it. And that we want to be free of that suffering and we want to be happy. And I think we can agree that every single person in the world shares that desire. So thinking of people being just like me in that way. So again, if you're in a place where it's available to you to close your eyes or drop your gaze, I'm going to invite you to do that. Again, doing whatever allows you to turn that attention inwards, finding a comfortable upright posture, and taking 3 deep breaths again, as we did at the beginning. In through your nose and out through your mouth. And again, with the very last breath, letting that out breath completely be exhaled, almost like a sigh. And then allowing your breath to settle into its own natural pace. And I'm going to invite you, using your mind's eye and some visualization, I'd like to invite you to picture a person for whom it's really easy to access feelings of care and love for. So this might be a family member or a close friend. Could even be a pet. Just a being for whom you can easily feel connected to. And I want you to really picture them in front of you. Maybe even picture a time when you were sharing a moment of joy with them. And noticing how you feel when you think about them. And considering that just like you, this person has had ups and downs in their life. Just like you, this person has goals and dreams. Just like you, this person knows what pain, sadness, anger, and fear feel like. Just like you, they want to be loved and they want to love others, to contribute and be appreciated. And with this in mind, I invite you to just silently repeat to yourself, just like me, this person wishes to be happy and free from suffering. Just like me, this person wishes to be happy and free from suffering. Now, letting the image of that person go, I'll invite you to bring to mind somebody that you might recognize but not have any special sense of either closeness or conflict with. So this could be a neighbor that you see often but you don't know well. It could be somebody that you see at the grocery store or the coffee shop. Notice how you feel when you think about this person. And considering that just like you, this person has had ups and downs in their life. Just like you, this person has goals and dreams. Just like you, this person is an object of deep concern to someone. They are a child to someone, a parent, a spouse, or a dear friend to someone. And just like you, this person knows what pain, sadness, anger, and fear feel like. They want to love, they want to be loved. Just like you, they want to contribute and be appreciated. And again, with this in mind, repeat silently to yourself. Just like me, this person wishes to be happy and free from suffering. See if you can feel this fundamental truth. Just like me, this person wishes to be happy and free from suffering. And now bring to mind somebody that you might have some difficulty or discomfort with. Not necessarily somebody that is the most difficult for you, but just somebody that you find irritating or that you don't easily get along with. Notice how you feel when you think about this person. And again, consider that just like you, this person has had ups and downs in their life. Just like you, this person has goals and dreams. Just like you, this person is an object of deep concern to someone. They're a child to someone, a parent or a spouse, or a dear friend to someone. Just like you, this person knows what pain, sadness, anger, and fear feel like. Just like you, this person wants to love, be loved, contribute, and be appreciated. And with this in mind, repeat silently to yourself, just like me, this person wishes to be happy and free from suffering. Just like me, this person wishes to be happy and free from suffering. And now picture all three of those people in front of you, your loved one, a neutral person, and a person with whom you have some difficulty. And remember that they all equally share the same basic desire to be happy and free from suffering. On this level, there's no difference between these three people. And for all three of these people, just mentally repeat, may you be free from suffering. May you know peace and joy. And now thinking to yourself, my life is supported in many ways, big and small, by countless other people, including those that I consider to be friends or strangers. And for all of us in ways we'll never truly know, our lives are supported by countless others. And in ways you may never really know, you too play the same supportive role in the lives of countless others. And as we come to the end of this practice, just rest in this feeling of common humanity and connection with others. And then slowly just letting your mind come back to the natural rhythm of your breath. Noticing that breath flowing in and out of your body. And then slowly starting to return your attention to the space where you are. When you're comfortable, you can open your eyes. So that's an example of one of the practices that we do in compassion cultivation and in cultivating compassion cultivation in healthcare. Um, and specifically the practices for the basic CCT, not basic CCT, but they're longer practices. These have been also shortened, recognizing that people only have so much time in their day. And we, during the class, also talk about a lot of in-the-moment practices that can be done even when you're at work that are only maybe 30 seconds long, 20 seconds long. Um, so with that, we'll move on to the next next slide that's got more information on the actual course, and we'll be offering our first iteration of the course starting October 3rd. And there's some information here on how to sign up, but I think I'll invite Abertine back on screen and we'll take any questions at this point.
Thank you, Shireen, for guiding us and grounding us in the work. I so appreciate your time and presence. So our chat is not working right now. So if anyone's got any questions or ideas or inspiration, please send those over to our email, which is health@compassioninstitute.com. Again, health, HEALTH @compassioninstitute.com. And I'll just kind of go over some of the frequently asked questions that have come up as we've shared this work with other folks in our community. One is, can I get continuing education units or continuing medical education units for this? As it is our first kind of inaugural class, we will not be offering CEs for this round. However, it's something that we're definitely considering for future iterations of CCHC. Another common question that we've gotten is, what if I can't attend a session? Should I still sign up? I know I'll be on vacation or something like that. Yes, we encourage you to sign up. Of course, the invitation is for you to be fully present and connected to the material, but also to the community of practice that will be present, which also means that we don't record the sessions. It's very kind of intimate and for us to experience as it's happening. So that's worth mentioning for folks. And then finally, this question of this is great, and I'm curious, uh, but what about the people that I work with, or how can I bring this kind of work to my institution or clinic or community? So we do a lot of custom work. We build partnerships with folks everywhere we go, and we're happy to explore what that might look like for you and your place. So again, any inquiries you have about working more closely together, building something together, addressing some need or challenge in your institution, we're happy to think through that with you. And you can reach us again at health@compassioninstitute.com. So I will pass it on to Jonathan Ayala. He's the program manager of health here at CI, and he's going to talk about our scholarship program.
Awesome. Thanks, Apro, and thanks, Shireen, also for that wonderful presentation. Super excited, and I think everybody should be excited too. Again, like Apro and Shireen were saying, this is our inaugural CCHC, and so it's going to be part of our menu of options. So, we really are excited about it, and we hope that you are too as well. So, like Shireen was saying, you can scan the QR code, and we're going to throw the link in the chat of where you can find a little bit more information about CCHC, including the schedule. But I want to talk about another inaugural that we're doing here in the health team, and that's a community scholarship program. So we know at this point, unless you've been perhaps living under a rock or in the deep forest, and I'm jealous of that, we know that things have been hectic and healthcare workers have been under a lot of stress, not just this past year, but really, for the last few years. And so we have been thinking about ways in which we can really expand our reach to folks and communities who we really want to support and who are doing great work, and we want to support them to continue doing great work. So with that in mind, we designed this community scholarship program, which is for folks, clinicians, healthcare workers. So that's physicians, nurses, what have you. If you consider yourself a healthcare worker, who work in community-based organizations, and here in the United States, that could be a CBO, an NGO. Elsewhere around the world, it could be an NGO, FQHC. So really, any sort of venue that serves communities, vulnerable communities, priority populations, and who may not have access to resources to take a class like CCHC. So we really want to open up this opportunity to take CCHC to those folks. So we've designed a short application process, which you can find at the QR code, and we're going to put that link in the chat. And selected applicants will be able to take the course free of charge. Scholarship seats are limited, unfortunately. If we could, we would offer this to everybody who needed it, and maybe one day we'll be there. But right now, we are doing this by application, so unfortunately, not everybody who applies will be selected. So thank you for that grace. If you are selected, we ask that you attend each of the sessions, given the competitive nature of the program. And then we also do some post surveys as well to help us with our refinement and our research and development and evaluation. So we do ask that you fill those out as well as part of that application, excuse me, as a part of that community scholarship program. Deadline. Okay, you still have time. It's not till Monday, next Monday. So August 25th is the deadline, end of the day that day. So you have some time over the weekend to cogitate, look at the question, think about the questions, really kind of put some thought into it. And hit us up with any questions if you have them from now until Friday. We'll get you an answer, and Monday too. We'll get you an answer until then. But yeah, we're hoping, this is a great opportunity to reach out to more folks who and bring more folks into the fold who really could use this opportunity to take CCHC. We have a couple more wrap-up slides. Trisha, can we run to the next slide, please? Okay, cool. But as for immediate next steps, we invite you to visit our CI website. On there, you'll see a bunch of different resources, free, open to the community. You can look at some of our research that on compassion cultivation, as Dr. Mansouri was saying. There's also a bunch of other recordings and resources. Please do check that out. If you liked this event or you're curious about other events, check out our YouTube channel. Subscribe to that. We do webinars and live events and meditations and guided practices, whatever you might call them, pretty regularly. So keep up to date, subscribe to that, so you know when the next events are happening. If you do have questions, sorry about the chat, have some compassion with us on that chat, but send your questions to health@compassioninstitute.com. That one we check very, very often, so we will get back to you with any answers that you may need. And finally, because we do love research and evaluation, we have a very, very short survey. So if you wouldn't mind snapping that QR code, Trisha's going to also drop that into the chat as well. So take a minute, let us know how we did, let us know what you want to see in the future. And that, I think, is it. So remember, August 25th, we hope to have your scholarship application. Otherwise, we hope to see you in CCHC. And thank you very much for your time. We'll see you around and next time.
Thank you, Jonathan, and thank you everyone for being here. Thanks, Dr. Mansouri, as always, for guiding us to where we need to be. So we'll be closing our webinar for today, and hope to see you around soon. Take care, folks.